Hello, we're going to talk today a little bit about the voice clinic that we have here at the Broad Green site at Liverpool University Hospitals. I'm Sally Dennis and I'm a speech and language therapist specialising in voice.
And I'm Joanne Clayton, also a speech and language therapist specialising in voice, but I've also got in special interest in respiratory disorders and ILO and complex dysphagia cases. As well as working in ENT, I also work with the respiratory services, and we see lots of patients who are having breathing difficulties centred around tightness in the throat or noisy breathing, and in those instances we do bring patients into the clinic here so that we can do an endoscopy and have a look at the larynx, the way that it's moving, just to rule out if there's any structural disorders that could be causing the stridor. And also to allow some biofeedback for the patients themselves to actually look at the movement of the larynx, to practice different manoeuvres whilst they're looking at the images, and that can really help from a sort of therapeutic perspective. From the dysphagia perspective, we tend to see patients in the clinics here who are quite complex cases who don't have an obvious cause for the dysphagia. So we tend not to see so much, stroke patients, but more patients where the dysphagia is a little bit more complex, not really sure of the cause of the dysphagia. And we do have the advantage of having access to fees and video fluoroscopy. We also send quite a lot of patients for manometry and pH studies. So we're really trying to unlock the cause of the dysphagia in this clinic here and to help with the diagnosis so that the team can manage them more effectively.